Do it.
So for my speech with me today, I have with me my dad, my aunt, my grandma, my grandpa, and my cousin. My grandparents here are from my dad's side, and my grandma with dementia is from my mom's side. My informative speech is about what dementia is, the warning signs of having dementia, and medication and education to help deal with the disease. Dementia is a brain disease that causes a long-term and decrease in the ability to think and remember things and also affect a person's daily functioning. There are different forms and stages of dementia, but each of them all equally creates a hardship on the patient and immediate loved ones. According to the Alzheimer's Association, Lewy body dementia, or LBD, is a type of progressive dementia that leads to a decline in thinking, reasoning, and independent function because of abnormal microscopic deposits that damage brain cells over time. So for example, the independent functioning part, someone with Lewy body dementia will struggle using the bathroom without assistance, or even as something as simple as getting dressed to get ready for the day. Some symptoms for Lewy body, according to the Alzheimer's Association, are well-formed visual hallucinations, delusions and changes in thinking and reasoning. Another form of dementia is one that you may have heard before is Alzheimer's. Alzheimer's is when you begin to have difficulty remembering things that you did and mood swings. Most people believe that Alzheimer's and dementia are different things, but Alzheimer's is a form of dementia just with similar symptoms, like forgetting things and different mood swings and personality changes. There are also different stages of dementia. According to the medical author Janet C. Taylor, stage 1 is no impairment. The patient has no problems. Stage 2 is questionable impairment. The patient begins to have some difficulty but can still function independently. Stage 3 is mild impairment. The patient has obvious but still mild difficulty with daily activities. Stage 4 is moderate impairment. The patient needs help with caring for him or herself as well as with carrying out daily activities. Stage 5 is severe impairment. Patients are unable to function independently. According to the medical author Janet C. Taylor, risk factors for dementia include age, family history, heavy alcohol use, hardening of the arteries, high blood pressure, diabetes, and smoking. According to the Alzheimer's Association, some warning signs for having dementia are memory loss that disrupts daily life, challenges in planning or solving problems, and difficulty completing familiar tasks at home or at work or at leisure, and confusion with time or place and trouble understanding visual images and spatial relationships. As there is no cure for dementia, however, there is medication and education that can help the patient and their families cope with the illness. The U.S. Food and Drug Administration has approved 2 types of medications: Aricept, Exelon, and Razidin, and Namenda to treat cognitive symptoms like memory loss, confusion, and problems with thinking and reasoning. According to the Alzheimer's Association, Aricept is approved to treat all stages of Alzheimer's. Exelon is approved to treat mild to moderate Alzheimer's, and Razidin is also approved to treat mild to moderate Alzheimer's. An effective treatment that is done to keep the memory from fading away more than it already is repetition. Repeating who you are and what you are doing. As for my grandma, she has now had dementia for about 3 years due to her liver condition called cirrhosis. She has problems with recognizing people, even her own family. For example, last month when my mom, my brothers, and I went to visit her, she did not recognize us and ended up panicking and was afraid. The house is pretty much childproof due to her curiosity with things around the house. She confuses the toilet for a sink and she wants to wash blankets in the toilet. She has to be convinced to use the toilet. And for example, my mom has told her that it's safe, it's okay, it's nothing going to happen to you when using the toilet. My mom and her sisters have had to put a childproof covering doorknob with an alarm so when she opens it, it can scare her away and she will not go out. The reason why they had to do this was because my grandma keeps saying she's not home and that she wants to leave to her home. If you or a family member have any of these symptoms, for more information, you can go to www.alzheimersassociation.org. That's my speech for today, and thank you for coming.